Hi, thank you for tuning back into the Really Cool Humans Network. I'm Dr. John Hatch, and back behind this door is Dr. Casey Oliver. You'll see him in a second. What we're showing you today is the importance of analyzing the eyes and ocular system to help with people with severe disorders and dysfunctions. Come on and let's check it out.
Hey everybody. This is the VNG, the micromedical VNG technology.
So what we're going to do, these are infrared goggles with lenses. We're going to place these on Dr. Oliver's head. And you can see them right in there, really nice. What we're going to do over here is we have to calibrate. Everybody sits differently, positions differently. It's calculated very, very precisely. So we're going to calculate these eyes. We're going to see where his eyes are in space. We're going to make sure that his eyes are neutral, that the cameras pick it up. Go ahead and look to the left, look to the right, look up, and look down. And those are great. Okay, so now we're going to run the test. We come over here. Is this level
A little bit higher.
A little bit higher. We want to make sure it's exactly where they see it. Is that good? Eye level?
Yep, looks good.
Okay, perfect. And then we got to calibrate it. It's got to be perfectly calibrated. So we're checking to make sure it quantifies his eye movement with what the actual icon is doing. And there's a series of tests that we're going to show. We're just going to show you a few. The first test is one of our favorites. This is what we see, what happens when you're completely in the dark. What do your eyes do at night while you're sleeping? We know in rapid eye movement or REM sleep, we know that those eyes are moving. And so what area of the brain controls that? That's what we need to know. And so we want to know what's happening in his eyes. As you can see, we can see his eyes really good. So go ahead and look forward like you're looking at a target. And we're going to watch and see what his eyes do. We're going to see if they move. We're going to see how many times he blinks. We're going to see, this is one of the best things we can see for concussions. When you see concussions, we see this little thing called a square wave jerk. And the square wave jerk is a problem with the neurointegrator on your brainstem. And you're like, what's a neurointegrator? Well, that's what holds the eyes on a target. And if that's not there, it slips. And then your vision is shifting and moving, and it causes you to make a refixation saccade or move your eyes back onto the target, and that can create a lot of fatigue. It can also create dizziness. It can create depth perception issues, post-it issues. And that test is done. And then we can go through each individual test, but we're going to go through the pursuit horizontally. We're going to show you when he's following the target. So now the target is going, and we're going to watch. Oh. Yep. We're going to watch his watching that target, and we want to make sure that his eyes are exactly on the target. We're following it here. We have the graph that's showing exactly what the computer program is doing and what his eyes are doing. It lets us know when he's blinking, when he makes a mistake, when his eyes shift off of target, how well he does it. And this is the highest function of the brain, the ability for us to follow a target. And it's just very, very important information to each aspect of the brain. And then we speed it up and we see how does he do with speed. I mean, these are happening all the time. Think about it when a dog comes out in front of you in your car. Think about when you're driving and the car next to you is traveling at a certain rate. Think about when you're watching a tennis match and you're watching the tennis ball fly across the screen. This is as us being athletes. Following a ball that's thrown at us. I mean, so much in our life is our ability of our brain to calculate the movement, the speed, the accuracy, everything. And then this test, this is really impeccable to how our brains function. This is the optokinetic response. And as you see here, what's about to happen is you can look here on the screen and there's multiple targets, okay? Now when we do this, we're usually completely in the dark. We're just not doing it in the dark right now so that you can see what's going on. But if we were to perform this test, we would do all of these completely in the dark. So the only thing that Casey, Dr. Oliver, is seeing is this movement. I'll show you really quick. So when the target is off, that's what he's seeing. That is his world. That is his experience. But for now, we'll keep the lights on so you guys can see what's happening. And what we're going to have him do is watch it as if he's watching a television screen, and let's watch and see what his eyes do. Here we go. Now, those of you that get motion sickness, those of you that get car sick, those of you that get vertigo or other concussion-like syndromes, this is what we call an optokinetic nystagmus. This is a normal reflex of the brainstem. Sometimes this happens for people even when nothing is moving. And as you can see, the targets are moving at quite a rapid rate. So now we take this information and we analyze it. So let's go ahead and analyze it. There's multiple other tests. Those are the ones we're going to show. Thank you, Dr. Oliver.
You're welcome. Get to see my cool goggle lines on my face.
So we're going to show this activation here. Let's run through some of these tests. Because these tests help us really to analyze frontal lobe weaknesses. When the eyes are moving fast to a target, that's your frontal lobe that does it. This is what makes executive function, cognitive function. So those when we see with Parkinson's, dementia, Alzheimer's, if we see that decay in the activation of those eye movements, we can then have to send out for more testing or send them to other doctors and say, hey, we need to get on this now because we're starting to see the degeneration start to occur just by movement and function.
Or maybe you know someone that maybe deals with anxiety, depression, difficulty making decisions. I know that's myself and my wife. When we go to a restaurant, she sits there in front of a menu for half an hour before she chooses something. That is like Dr. Hatch said, the executive brain, that frontal lobe that helps us. It's really what makes us human. It's what sets us apart from all of the other animals in the kingdom. So you know someone that maybe has a hard time making decisions. Maybe they don't behave properly in public like they're supposed to. Anxiety, depression, those are common things that we see when these mechanisms that we're measuring here with the VNG aren't working very well.
Okay, great. So let's get to the 3 tests that we looked at for Dr. Oliver. So we can analyze it, we can go back, we go over these with each person, and what's great is we can post-check these and see what happens. So we're looking at what his eyes are doing, how he is performing in the dark. And
we look at general eye position as well. We look at general pupil size. So if you're looking at the screen, we're seeing is there a deviation somewhere. We look at the light reflex that's on there. Is there an eye that's turned in? Is there an eye that's turned out? Just looking from here, it kind of looks like, if you see that too, maybe a little mild anisocoria in the left eye. So the left pupil's a little bit bigger than the right side. So those are things we look at here in the nystagmus test as well.
Mm-hmm. And we can see this with people with what we call convergent spasms or accommodation spasm. And that's people that are always feeling the world moving even though they're not. They're feeling nauseous when they read, or they get really tired when they read, or they get headaches when they read.
Yeah, that was one I was thinking of.
Common.
Headaches, like people that sit and work in front of computers all day long, they get eye strain. Accommodation spasms are huge with that. I mean, their eyes are moving when they're not supposed to be moving in convergence or divergence, and it becomes a problem for a lot of people. They come in all the time. I can't tell you how many times people come in here and they tell us it feels like someone's stabbing the back of their eyeballs with knives, and that type of headache that people get is part of eye strain. So we're able to analyze that here.
Yep. And so then the following test, as we mentioned before, was that pursuit test. In that pursuit test, we can see him following this target. Up is to the right, down is to the left. We're seeing blink responses. We see if he's off target, and he's right on. We see this a lot with the inability to read. You can't follow and pursue a certain way, and there's fast eye mints and there's pursuits. And if those break down, we'll see a major trouble with this. And we see it at all different levels.
That's not bad.
And it's really spot on. Way to go, doctor. Okay. And then lastly, as was mentioned, was the optokinetic response.
So just a couple examples of where we find this in the real world. You're walking up and down the grocery aisle. Things are passing you. If you know anyone that gets motion sick in a car, you're driving down the highway and cars are passing you this way. Trees and other buildings are passing you on the other side. Your brain's got to be able to react appropriately to that type of stimulus. This is a natural reflex, or what we call the optokinetic reflex, but our brain's got to be able to attenuate or inhibit or dampen that down, override that essentially, because we see this all the time with conditions like that.
And how many times have we all sat in the car, we have our head down because we're thinking about something or looking at something, and the car in front of us moves forward, and we slam on our brake because we think we're rolling back. Or they start to go backwards, so we think we're jarting forward. That's because the impression of movement, even if we don't move. And how many of us feel that?
That was one of the first car accidents the only car accident I ever got in was after a long night of labor. My wife gave birth to our beautiful baby boy, and I was awake for 30 plus hours, and I'm sitting there. I had to run to a quick event when I was actually in chiropractic school, and I was coming back to the hospital. I was sitting right in front of the hospital. I had my head down. The person in the lane next to me was turning left. Their car started to go, and so I let go of the brake, and all of a sudden I just hit the person right in front of me. I wasn't on my game that day.
So we can see these and analyze this, and Dr. Oliver has a very good example of what normal looks like, and good, fast, rapid eye movement. So we can play this again. This is the beauty of it. We can show you how this is done, what's happening to your system. And this is just looking absolutely great. And this is as the stimulus is coming to his left. Gives him the impression that he's rotating to the right. If you've ever, like right now, I'm staring at you, but as I rotate to the right, you go to my left. And that's what this optokinetic response is happening. And then we can look at it versus his going to his right. And you see to the right, we have different shapes, we have different speeds, we have small ones and large ones. That's not a normal response. We want to improve that, where going the other way, it was absolutely clean as it should be. So these types of things we're going to break down. We're going to see how detailed we can get to see what aspect of your brain or function in life isn't working and try to improve that through our therapies. Then once we've locked that in, we're going to retest these and see if they actually make a difference. And if they do, we expect your symptoms and those challenges that you're dealing with to change. If we can get these things to change, we should get changes in your system.
So if you're someone that gets car sick, we take a baseline, we find out where the dysfunction is, where the weakness is, we can give you appropriate therapies. We give you those therapies, we got to see if the car sickness starts to go away, if the dizziness starts to go away. Most medical physicians will use this type of equipment, doing caloric stimulation, for example, putting cold or hot in the air, trying to see what how the vestibular system is acting with the eye movements. So is the vertigo going away? Are you less dizzy? And the list goes on and on and on about these conditions that we've already talked about. This is why we use this type of equipment, is because we've got to measure it, we've got to apply therapies, and we have to monitor change. We have to monitor and make sure that we're doing our best to get these symptoms to go away.
And you parents that are concerned about concussions, the question is, when your kid's playing football or lacrosse or soccer or basketball, or they're swimming and they hit their head, is that the first concussion? Is that a second concussion? And we know they exponentially get worse if the brain can adapt. So the question is, what's my child's baseline? We love to have kids come in and get a baseline. So then if something ever occurs in their sports, which we don't want to happen, but if it does, we can compare what's happening now before a concussion to what's after. Not, well, was this a pre-existing issue, or is this actually a concussion-based syndrome? We can know.
And just remember, this isn't what we base our entire practice off of. This is just one piece of equipment. We use this in concert with the sacodometry. We use this in concert with CAPS posturography, and our bedside exam that we do to paint a perfect picture for you. It's kind of like gathering pieces of the puzzle, putting the puzzle together to figure out what your presentation is or what you're experiencing in life. And so just remember, that's a piece of equipment that we use. That's just one minor portion of our exam, but we love it because it works. It's a phenomenal piece of equipment. Come use it. Thank you, everybody, for joining us again. We're on the Really Cool Humans Network. I'm Dr. Casey Oliver.
And I'm Dr. John Hatch. If you'd like to get in contact with us, please contact us at theneuroclinic.org, or feel free to call us directly at area code 801-766-6580.
See you next week.